Hello doctors, I'm your med buddy Arun and I welcome you to my last and the 8th lecture of this series on diseases caused by gram-positive bacteria. And in this lecture, I will tell you about all the species of Clostridia group that are responsible for infections apart from tetanus and botulism. These infections are gas gangrene and associated infections. I will take you through the microbiology, epidemiology, risk factors, toxins produced by these species, types of infections, their clinical features, and finally the treatment of the infections caused by these species of Clostridia. So let's get started. Microbiology. In lecture 6, we have already discussed the main components of microbiology of Clostridia group. Here we will know about their motility. Clostridium septicum has a motility due to peritrichous flagella and its motility is called swarming motility. The non-motile species of Clostridia is Clostridium perfringens. Epidemiology. In the same lecture we have broadly discussed about the epidemiology of this group of bacteria. The risk factors are the post-abortion stage, diabetes plus wound or surgery, intravenous or subcutaneous drug abusers, immunosuppressed population, and population with low income group that have to eat spoiled food and have poor living standards, gunshot and knife wound injuries, also the animal bites and post-surgical infections, and the population which has not taken the vaccine against this group are more at risk. There are several toxins produced by these species. Some of them are neurotoxin, enterotoxins, collagenases, neuraminases, necrotizing toxins, lipases, lecithinases, hemolysins, proteinases, hyaluronic acid, ADP, ribosyl transferase, botulism causing botulinum, tetanospasmin, and perfringolysin and DNases. Perfringolysin is also called as theta toxin, while DNase is also called as alpha toxin. They are associated with a broad range of infections from normal intoxications such as tetanus and food poisoning to the necrotizing enterocolitis, bacteremia, and deadly toxic shock syndrome. The first type of infection is associated with wound contamination by the spores of Clostridia species. These spores require a special environment for their germination. What is that? They need devitalized tissues, that is the dead tissues which do not have blood supply. In absence of blood supply and these kind of devitalized tissues are gonna provide the anaerobic media to the spores which will let it germinate. After germination there will be proliferation of the Clostridia bacteria and it will lead to suppurative infections. It has been seen that in most of the infections these Clostridia are obtained equally with equal frequency, be it a healing wound or a suppurative wound. The Clostridia is gonna be obtained equally, so the treatment will be based on the clinical features. Clostridia may be present there, but not necessarily it is going to show the clinical features because it requires a specific medium. Another type of infection that is caused is polymicrobial infection. It is associated in severe infection and seen in severe infection where there is our indigenous flora and Clostridia together. But the sign of specific clostridial infection will be absent in such infections. What are those signs? They are toxicity and rapid progression of the clinical features that will be absent in such infections. In up to 66%, GIT and respiratory infections such as sinusitis, otitis, brain infections as well, Clostridia species are obtained, but these clinical signs are gonna be absent. Clostridium ramosum, Clostridium perfringens, Clostridium bifurcans are seen in suppurative infections of female reproductive tract, and they have also been seen and are responsible for the gaseous infection of gallbladder, that is also called as emphymatous cholecystitis. The polymicrobial infections, when associated with Clostridium perfringens, they are majorly seen in diabetics, and this emphysematous cholecystitis will be seen mainly in diabetics as a complication. Enteric infections is the another type of infections caused by this group of bacteria. How it progresses. Some species of Clostridia have EPC gene. I'm gonna tell you that species. Okay, EPC gene is responsible for the formation of enterotoxin. This enterotoxin form pores in the intestinal mucosa. Once the pores are formed, there will be sporadic progress in the clinical features, and they are also associated with overuse of antibiotics. Enteric infections are mainly due to Clostridium perfringens type A and Clostridium perfringens type C, and they are seen associated with intake of uncooked meat and meat which is cooked with a gravy or watery sauce, and that is kept for long hours. The intake of this contaminated meat, which generally carry the spores, is gonna lead to enteric infections. The type of enteric infections are enteric necroticum. It is caused mainly by the Clostridium perfringens type C. This Clostridia produces alpha and beta toxins. What are these? Alpha toxin is the DNase, and these toxins together causes severe ischemia or severe reduction in the blood flow in the jejunum, in the walls of jejunum, which there produces a anaerobic media, and this anaerobic media is perfect for the growth of Clostridium perfringens. It will be growing there, it will be producing certain toxin which will lead to gas gangrene of the bowel. It is the most common reason for the death of children associated with enteric infection and enteric infections in diabetics. Another type of enteric infection is necrotizing enterocolitis. It is seen mainly in the preterm infants, and it has the same pathogenesis that enteric necroticans have. Same toxins are produced, alpha and beta, but it is mainly seen in preterm infants and in the region of ileum. Enteric necroticans is associated with necrosis of jejunum, while necrotizing enterocolitica is associated with the gas gangrene of ileum. It is responsible for bacteremia. Which species are mainly responsible for bacteremia? They are Clostridium perfringens, Clostridium tertium. The bacteria due to these species can be present without any site of injury, without any injury as well. But if there is injury and this bacteria is present, it is gonna show the worst prognosis, that is a grave prognosis. Clostridium septicum. Clostridium septicum, if it is seen in blood culture, that means that person is having a GI malignancy or diverticular disease. Clostridium septicum in itself is not deadly, but it is a sign of these pathologies that are GI malignancy and diverticular diseases. Clostridium sordi and Clostridium perfringens together are responsible for the toxic shock syndrome, and they all can be seen causing bacteremia in person with cirrhosis and severely ill patients. It causes skin and ST infection, that is soft tissue infections. Species that are responsible for skin and soft tissue infections are Clostridium perfringens, Clostridium histolyticum, Clostridium septicum, Clostridium novi, Clostridium sordi. They produces alpha and theta toxin. What are these? Alpha toxin, again the DNase, theta toxin, perfringulicin, and also the toxins such as proteases, phospholipases and cytotoxins are produced by these species. What do? They causes Clostridia associated myonecrosis in two forms: the traumatic gas gangrene and spontaneous gas gangrene. Traumatic gas gangrene is associated with a trauma or injury. It is a surgical emergency. Incubation period is 6 hours to 4 hours. How does it progress? The penetrating wound contaminated with the spores and presence of devitalized tissues that is gonna provide them an anaerobic media will lead to the germination of these spores. After germination, Clostridia is gonna increase in number. It is gonna produce several toxins that we already talked about. These toxins in first step are going to reduce the blood flow toward that wound and the nearby area. It will provide a anaerobic environment for the bacterial growth, which is perfect for its growth and for causing gas gangrene. Clostridia is the normal commensal of our bowel. If surgery is performed on the abdomen or in proximity to the bowel, there are more chances that those surgical injuries are gonna be contaminated by the Clostridia species. That is called the fecal contamination. It again will lead to increase in Clostridium number, production of toxins, and will lead to gas gangrene again. Its features are sudden pain. There will be sudden rise in pain in the area of wound or surgery. A very foul smell will be there. There will be discharge of sergangeous kind of material, gas bubbles which are mainly of hydrogen. These all together will finally lead to an increase of flux of cytotoxin, which is gonna cause sepsis, shock, organ failure, and death in up to 50% of patients. Another type of this gangrene, of this myonecrosis, is spontaneous gas gangrene. It is mainly seen due to the hematogenous seeding. There will be no trauma or nothing. It is seen in the patients who have reduced immunity, who have chronic diseases of bowel such as enterocolitis or diverticular or cystitis. Due to this, the Clostridia that was firstly present as a commensal in the gut is gonna enter the blood. After entering the blood, it is gonna multiply there, and it will start causing the seeding complications. It will start germinating in a specific organ and in multiple organs, and will lead to multiple organ failures. The treatment of this. The treatment of Clostridia infection associated with wound. First of all, in most of the wound, as we already talked about it, we are gonna see this Clostridia, but it does not always means that we need to provide some antibiotics to the patient. Until we see the clinical features, then only we are gonna provide the antibiotic treatment. So in case of wound, what we need is the hygienic care of that wound, and if clinical signs appear, then only we are gonna provide the antibiotic treatment. In case of polymicrobial infections, we need to provide ampicillin plus clindamycin plus ciprofloxacin. Ampicillin 2 gram IV every 4 hours, clindamycin 600 to 900 mg IV 6 to 8 hours, and ciprofloxacin 400 mg IV 6 to 8 hours. Its alternative are vancomycin, metronidazole, and ciprofloxacin in patient with allergy to penicillin. For clostridial sepsis, we need to provide penicillin 3 to 4 million units per 4 hours plus clindamycin. The alternative of it is clindamycin or vancomycin or metronidazole. In case of gas gangrene, first of all, gas gangrene is a surgical emergency. It is not gonna be treated only by the antibiotics. We need the surgical debridement, the amputation of that organ immediately. After amputation is followed by the antibiotic regime, that is penicillin plus clindamycin. Penicillin the same unit and the clindamycin the same dose. In patient with allergy to penicillin, we are going to provide cefuroxetine and clindamycin. Thanks for watching.